Engineer John Baptist Nambohe. I'm the Commissioner for Emergency Medical Services at the Ministry of Health, Uganda. I'm here on behalf of the Ministry of Health, attending the health dialogue culture. In the care of patients, the most important thing which we need to incorporate, as seen from this health dialogue culture, is the issue of treating people with respect, with dignity, and with love. These are some of the missing ingredients when we care for people. Sometimes we care for people and we are looking at just the body. Have I healed this broken limb also? But the other aspects of respecting the person, showing love to the person, and helping a person in need may be missing. And that is what we come to learn. The Foyer movement looks at building that other aspect of care. The origin of this modern medicine is based on actually the plants, the trees, the what, and the African medicine is also based on this. Extracts of leaves, trees, and so on. So when you incorporate this, some of the care is based on the way people were brought up. You find that there is care from the mother, from the father, from the auntie, and so on. All these help to fulfill another aspect. So on part of medicine, you find that the modern medicine originates from traditional medicine, especially trees and plants. And part of care or behavioral, you find that the African culture has inbuilt care mechanism. When you impart them into this modern care, then someone gets a complete or holistic picture of care, especially being alongside someone when he's critically ill, or even in the last days. As you know, like for us Africans, we believe that someone, even if he has died, he will continue having influence over a person. So the care you give to this person when he's dying is very important. So it is the same. That is the same way in which you look at it in terms of this Foyer movement or care, and it comes in and fulfills the Christian values of caring for your neighbor. Telemedicine is a new approach, and in this health dialogue culture, there will be a presentation on it. But we have already started, as you know, in the health sector, telemedicine is already operational. You have seen where we can have someone at a distance, maybe is in Gulu, has fractured or has got an injury, and X-ray or CT scan is done there. But the doctor who is reading it is in Mulago and is able to read and pass on that knowledge. So telemedicine is the way to go.
The question of the traditional medicine in Africa, one is that God endowed Africa with a lot of medicine, especially from crops and plants. Some we know, some we don't know. With the wisdom of our grandparents, they were able to discover, to find out that some of the plants are medicinal also, of medicinal character, and they would encourage people to use them when you get sick. When I grew up, I didn't grow up in a city locality, but a village locality next to a lake. So would you feel headache or feel fever or even cough, and the parents or grandparents will encourage you to take particular kind of plant, sometimes boil it, cook, to boiling point, and drink the juice that comes from it. and you get sick. So some people are endowed, God knows how to find people where whom he can use to find the particular medicine for different sicknesses. So we have the traditional ones, and those are encouraged very highly. The kind of discouragement that we can give as a church is witchcraft, because witchcraft is deceiving somebody when actually you're not going to heal it. But otherwise, there are people who are endowed, and they have got that talent to find medicine from the different types of crops that we have.